Hi everyone, my name is Nora Hendricks and I'm the Health Policy and Communications Associate at the Tennessee Justice Center. In this video blog, I will talk about the children's mental health crisis and ways that we can help children in Tennessee. First, I will talk about how Tennessee ranks compared to other states for some children's mental health measures. Then, I will talk about some solutions that have been proposed by doctors to help fight the children's mental health crisis. And finally, I will talk about a recent win in Tennessee for children's mental health. Tennessee and the United States are facing a children's mental health crisis. The crisis has only worsened with the COVID-19 pandemic. Tennessee ranks 34th out of the 50 states for having high rates of mental illness and low rates of access to care for children based on 7 measures. These include a youth having at least one major depressive episode in the past year, a youth with substance use disorder in the past year, a youth with a major depressive episode who did not receive mental health services, and 4 other measures. A major depressive episode is defined as a period of 2 weeks or longer where someone experiences certain symptoms of major depression. Tennessee ranks 40th of the states for children with major depressive episodes who did not receive mental health services. In 2020, around 61.5%, which is around 35,000 Tennessee children experiencing a major depressive episode, did not receive mental health services. Tennessee ranks 49th of the states for children with private insurance that did not cover mental or emotional problems. 13.5% of Tennessee children with private insurance, or 27,000 children, have coverage that does not cover mental or emotional problems. Now, I will talk about some proposed ways to help address this children's mental health crisis. Many doctors agree that it should be easier for children to get services to prevent mental health problems, and that there needs to be more children's mental health providers in Tennessee. Many doctors have also agreed that combining behavioral health with primary care would be helpful to children. About 65% of rural residents get treatment for mental health issues from a primary care doctor. So having doctors trained to use evidence-based practices to look for and treat mental health conditions would be helpful to many children living in rural Tennessee. Rural school-based health centers, also known as HBSCs, have also been suggested as a way to help provide children living in rural areas better access to mental health care. Having mental health care available in schools will make care easier to access for children who are going to school anyways. HBSCs have also been found to have financial benefits for the community. It has been reported that they have annual benefits between $15,000 and $910,000 per HBHC in prevented costs. Studies have also shown net savings to Medicaid from HBHCs ranging from $30 to $969 per visit, or $46 to $1,166 per user. Another recommendation for fighting the children's mental health crisis is to focus on promoting mental health during early childhood. Maternity care and children's healthcare services should focus on the mental and general health needs of children and parents. There should also be supports for new parents to build their skills to better handle family matters and help their children grow up healthy. School networks should support parents to exchange information, assistance, and encouragement. Finally, there should be more incentives for psychologists to accept health insurance and incentives to bring more children's mental health specialists into Tennessee. Many psychologists and social workers do not accept TennCare Medicaid. People enrolled in TennCare usually end up going to the same few popular agencies for treatment that are usually overwhelmed and understaffed and can be difficult to even make an appointment at. There are not enough facilities in the state of Tennessee to care for children who require more intensive mental health treatment, regardless of the patient's insurance. Tennessee has had one recent win for children's mental health. In 2020, the state expanded the Behavioral Safety Net program to include uninsured and underinsured children. Under this program, children who did not have access to full behavioral health services before now have access to essential outpatient mental health services if they have a qualifying mental health diagnosis. This is an encouraging step in the right direction towards helping children access the mental health care they need, but there is more room to improve. Tennessee is facing a children's mental health crisis. Increased access to preventative care, fighting the stigma around mental health by talking about it with children, and an increase in children's mental health providers and facilities can all play a role in helping to combat this crisis. We at the Tennessee Justice Center urge the Tennessee Legislature to prioritize spending towards children's mental health services and towards rural school-based health centers. Please contact your legislators and let them know that it is important to you that they invest in children's mental health. Thank you.